Okay, I will be doing an internal bolus feeding. First thing I would do is assess my patient medical record. I would check the physician order. I would check to see um, the rate, the route, and the formula I will be using for the patient. Also, I will gather all my materials, and then I will head to the patient room. I will knock on the patient door, do hand hygiene, put on my gloves. I will introduce myself. Um, I will ask the patient to verify her name and date of birth, and I will check with her wristband. Also, I will put my patient in a semi-filer position, which is 30 to 45-degree angle. Also, I will check the placement of the tubing to make sure it's still intact. Also, I will assess the bowel sounds as well. Also, I will check the pH to make sure that it's still in the right position. Um, Go back, wipe it back off. Check and make sure the pH is less than 5.5. Um, then I will check the formula. I will check and make sure that the formula is not expired. I will check and make sure it's not damaged. I will make sure it's room temp. Also, I will invert it. I will not shake it because I want the formula to have no bubbles in it to give to the patient as well. Also, when I get done with that, I will check the gastric residue. Um, the book says that the book said if it's less than 100 milliliters, and our checkout paper said if it was 250 milliliters, you can continue the feeding. If it's greater than that, then you have to wait an hour and then redo it again. And if it's still greater, then you have to call the doctor. But if it's less than 250 milliliters, then you could continue with the feeding. Also, you have to put back the gastric residue because if you don't, the patient be losing the electrolytes, the nutritions. Okay. Also, before I start the patient feeding, what I want to do is flush out the gastric residue that's in the tube. I want to flush it out at least between 30 to 60 milliliters of water. Okay. And while that's going down, I want to make sure that the patient that I don't get no air in the tubing. So I'll try to stop the feeding right here. I will clamp it off, and then I will begin the feeding. I will fill it all the way up, and as I'm doing my feeding, I will be observing my patient, making sure the patient's not in respiratory distress or anything. I would not raise the tubing above 15 or 16 inches above the site. And every time you do a feeding, you want to flush it right behind it as well. I'm going to do the last feeding. Then you're going to unclamp it. And as the feeding comes down to the last ending, I will flush the rest of it, the formula, out with 30 to 50 milliliters of water. Okay. Then I will clamp it off. Alright. And then when I get done with that, I will leave my patient in a 30 to 45 uh, degree angle, semi-five position for about an hour, just so the patient won't aspirate or vomit. Also, I will make sure I assess the patient, make sure that the patient not in respiratory distress, make sure the patient um, haven't decreased in the O2 set or anything. I want to make sure it ain't no increase enough coughing. And also, after I documented everything, also I will assess the patient breath sounds at least once every 8 hours, and then I will measure the aspirate once every 4 hours, just to make sure that the patient tolerate the feeding.